Understanding sexual disinhibition in dementia patients. Introduction. Welcome to our training session on understanding sexual disinhibition in dementia patients. This training is tailored to provide healthcare professionals with a comprehensive overview of inappropriate sexual behavior, ISB, in dementia care. We aim to offer valuable insights, enhance empathetic patient care, and empower healthcare providers with essential soft skills for addressing ISB. Let's embark on this enlightening journey together, enhancing our approach to dementia care with practical and impactful knowledge. Training objectives. 1. Gain a deeper understanding of dementia and its forms. 2. Focus on how these forms influence behavior, particularly sexual disinhibition. 3. Discuss the prevalence and significance of inappropriate sexual behavior, ISB, in dementia. 4. Equip you with non-pharmacological strategies to manage ISB. 5. Translate theoretical knowledge into practice. Dementia overview. Major neurocognitive disorder, most commonly known as dementia, is a complex condition that manifests in various forms, each with its own unique characteristics and behavioral implications. Let's explore the most common types and understand how they might influence behavior, emphasizing ISB. Alzheimer's disease. Alzheimer's disease, the most common form of dementia, is known for its progressive memory loss. As Alzheimer's advances, it also leads to functional impairment and changes in personality and behavior, including sexual disinhibition. These changes are attributed to the deterioration of specific brain regions, such as the hippocampus. Vascular dementia. Next, let's explore vascular dementia, which occurs due to conditions that interrupt the blood flow and oxygen supply to the brain, leading to brain damage. Brain regions affected. Vascular dementia can affect various brain regions, depending on where the blood flow is disrupted. Initial symptoms and their severity often depend on the size, location, and number of vascular changes. Commonly, it involves damage to white matter, the brain's connecting wires critical for relaying messages between regions. Symptoms and progression. Symptoms can include confusion, problems with memory and concentration, changes in personality and mood, and, in some cases, inappropriate sexual behaviors. These symptoms may appear suddenly following a stroke or gradually over time, mimicking the progression seen in Alzheimer's disease. Impact on behavior. Unlike Alzheimer's disease, where memory loss is a significant symptom, vascular dementia tends to involve more pronounced changes in the speed of thinking and problem-solving. Patients may exhibit mood swings and impulsivity, including inappropriate sexual behaviors, especially if the damage occurs in areas of the brain responsible for behavior and emotional regulation. Lewy body dementia. Now, let's discuss Lewy body dementia, LBD. While inappropriate sexual behaviors are uncommon in LBD, as in some other forms of dementia, they can still occur as part of the broader range of behavioral changes. Lewy body dementia, LBD, is marked by abnormal protein deposits in the brain, impacting both cognitive functions and movement control. These lead to Parkinson's disease-like symptoms, such as rigidity and slow movement. Additionally, LBD causes cognitive changes similar to Alzheimer's, like memory loss and confusion, but with unique fluctuations in cognitive abilities. Patients may also experience mood changes, visual hallucinations, including depression, anxiety, or agitation, contributing to the complexity of managing this condition. Frontotemporal dementia, FTD. Lastly, let's focus on frontotemporal dementia, or FTD, a form of dementia that uniquely affects personality and social behavior. Unlike other types, FTD primarily targets the frontal and anterior temporal lobes of the brain. These regions are crucial for controlling our behavior, personality, and language skills. Impact of frontal lobe degeneration. The frontal lobes, responsible for judgment, problem-solving, and regulating social behavior, can lead to disinhibition when affected. This means patients with FTD may act impulsively or exhibit inappropriate sexual behaviors. This change in behavior often results from the deterioration of brain areas governing judgment and self-control. Temporal lobe involvement. The temporal lobes play a key role in understanding language and processing emotions. Damage here may lead to communication difficulties, and reduced empathy, further complicating the patient's social interactions. Behavioral manifestations. These neurological changes directly contribute to the symptoms of FTD, particularly the disinhibited behaviors such as inappropriate sexual advances. It's crucial to understand these brain changes to manage these behaviors effectively and compassionately. Sexual disinhibition in dementia. Now, let's address a complex and sensitive aspect of dementia care: sexual disinhibition. This term refers to behaviors that are typically inappropriate within a given social context and may include making sexually explicit comments, inappropriate touching, or other sexual actions. Understanding the cause. As we've previously learned, sexual disinhibition in dementia often results from the brain's degeneration, particularly in areas like the frontal lobe, which is vital for impulse control, and the temporal lobe, which plays a role in social behavior. This degeneration can impair the person's ability to recognize and adhere to social norms, leading to behaviors that are inappropriate or out of context. Complex neurological changes. It's important to recognize that these behaviors are linked to complex neurological changes. For instance, in Alzheimer's disease, the deterioration in the cerebral cortex can impact judgment and behavior, while in frontotemporal dementia, the frontal and temporal lobes' degeneration directly affects personality and social interactions. Distinguishing disease from disposition. In managing ISB in dementia, it's vital to understand that such behaviors are symptoms of the disease, not reflections of the individual's character. This condition affects the brain's ability to process information and regulate behavior. Recognizing when patients may not be able to consent or engage autonomously is key. Providers must discern between appropriate and inappropriate behaviors, considering the patient's cognitive state. Our non-pharmacological approach emphasizes sensitivity and professionalism through behavioral interventions, environmental adjustments, and empathetic communication, aiming for compassionate and ethical care. By linking these behaviors to specific changes in the brain, we can better understand and manage them with empathy and knowledge. Prevalence and significance of ISB in dementia patients. Let's turn our attention to the prevalence of inappropriate sexual behavior, ISB, in dementia patients, a crucial aspect for comprehensive dementia care. Picture this: while ISB isn't as widely observed as agitation or aggression, its presence is still notable and impactful. Imagine a spectrum where on one end, earlier studies like those by Series and Degano and Stubbs show a prevalence ranging from 2% to 17%. Then, we move to a more recent analysis by Eshmaway in 2022, revealing a prevalence stretching up to 25%. This discrepancy highlights the varied manifestation of ISB in different settings and stages of dementia. It's not just about numbers, it's about understanding the diverse behavioral landscape we navigate in dementia care. Non-pharmacological management of ISB in dementia. Now, let's delve into the non-pharmacological management of ISB in dementia, contrasting it with pharmacological approaches. Our focus here is on creative, compassionate strategies that don't rely on medication. Understanding non-pharmacological versus pharmacological methods. While pharmacological treatments are available, they often come with side effects and ethical considerations. Our approach prioritizes non-pharmacological methods, emphasizing patient engagement and behavioral modification without the use of medication. Stimulation and activity. An underlying contributor to ISB can be a lack of stimulation. We'll explore how engaging activities, like music, exercise, arts and crafts, and reminiscence therapy, can redirect attention and provide necessary stimulation, addressing ISB's root causes. Environmental contributions. Environmental factors like lighting, noise, and room layout play a role, though not all aspects may be under staff control. We'll discuss what can be managed to create a supportive environment. Redirection techniques. First, we'll explore the art of redirection. This is like a gentle nudge in a new direction, shifting focus from inappropriate behaviors to more suitable activities. Engaging in favorite hobbies. Imagine a patient showing signs of ISB. Here's where a favorite hobby comes into play. Let's say they love gardening. We gently guide them to water plants or browse through a gardening magazine, effectively shifting their focus and channeling their energy positively. Music therapy. Music, a universal language, can be transformative. By playing a patient's favorite tunes or genres, we can create a mood shift, steering their attention away from ISB and towards the therapeutic power of music. Physical exercise. Let's get moving. Engaging a patient in mild physical activities like a stroll in the garden or simple stretching exercises can be a great way to redirect excess energy and refocus their mind. Art and craft. Art has a way of captivating the mind. Engaging patients in simple art projects can absorb their attention, offering a creative outlet for expression and a diversion from ISB behaviors. Reminiscence therapy. Finally, reminiscence therapy. Encouraging patients to share pleasant past experiences, perhaps through family photo albums or familiar objects, not only redirects their focus, but also provides a comforting sense of connection to their life history. Environmental adjustments. In managing ISB and dementia, even subtle changes to the environment can have a significant impact. While major environmental modifications might be beyond our control in a hospital setting, there's still ample scope for creativity and resourcefulness. This includes leveraging the expertise and collaboration of disciplines like occupational therapy, OT, and physical therapy, PT. Together, we can optimize the existing environment, making it more conducive to managing challenging behaviors effectively. Collaboration with occupational and physical therapists. Collaborating with OT and PT is crucial. Occupational therapists can provide insights into sensory adjustments and activities that promote engagement and reduce anxiety. Physical therapists can suggest safe, physical activities that are not only beneficial for health, but also serve as effective distractions from ISB behaviors. Lighting. Lighting plays a crucial role in influencing mood and behavior. Soft, warm lighting can create a calming atmosphere, reducing agitation and potential triggers for ISB. On the other hand, overly bright or harsh lighting might contribute to confusion and restlessness. Noise control. Managing noise levels is essential. A quiet, serene environment can help in reducing anxiety and stress. Using soft background music or implementing sound-dampening materials can be beneficial in maintaining a peaceful setting. Room layout. The physical layout of a room can impact a patient's well-being. Creating open, uncluttered spaces can help reduce confusion and stress. Ensure that the environment is safe and easy to navigate, which can help in minimizing disorientation and potentially inappropriate behaviors. Effective communication. Communication is key. Let's enhance our approach to managing ISB in dementia with effective communication, focusing on clarity, respect, and empathy. Clarity and simplicity. When addressing ISB behaviors, use clear, simple language. For example, instead of complex medical terms, say, "Let's focus on this activity now," to redirect attention. This straightforward approach aids in understanding and reduces confusion. Establishing firm boundaries. When a patient exhibits forward behavior, it's crucial to set clear boundaries. For instance, if Mr. Cullen begins to undress, a firm yet respectful response would be, "Mr. Cullen, please keep your shirt on. We need to stay dressed in the common area." This approach maintains decorum while ensuring the patient's dignity. Direct and unambiguous communication. Use clear, direct language to communicate boundaries. For example, if a patient makes an inappropriate comment, respond firmly, "That type of language is not appropriate here. Let's talk about something else." Respectful tone. Adopt a tone that conveys respect. If a patient exhibits inappropriate behavior, calmly say, "I understand this might feel important, but let's try this instead." This respectful tone reassures them and helps in de-escalating the situation. Empathy in interaction. Empathetic responses are key. Acknowledge their feelings with statements like, "I see this is upsetting for you," and offer comfort. This approach builds trust and makes it easier to guide them away from ISB behaviors. Maintaining professional physical distance. While maintaining physical distance is advised, we acknowledge that hands-on care often requires closer contact. Here, effective communication and boundary setting become crucial. It's about balancing necessary physical interaction with clear, respectful boundaries. Whenever possible, stand at an arm's length while engaging with patients. By integrating these strategies into your caregiving approach, you can manage ISB behaviors in a way that is respectful, professional, and supportive of the patient's well-being. All right, let's bring our discussion to life. We've covered key strategies for managing ISB. Now, we'll see these techniques in action with a practical scenario, demonstrating how to apply these skills in real caregiving situations. Get ready for a hands-on exploration of empathy, clarity, and respect in action.
You're looking beautiful today, Emily. Why don't you come a little closer and show me some love?
Thank you, Mr. Johnson. It's such a lovely day, isn't it? Let's focus on these beautiful flowers. I recall you have a keen interest in gardening.
Yes, I used to spend hours in my garden.
Roses are indeed beautiful. Let's take a walk around the garden and see our rose collection. Perhaps you can share some gardening tips with me? I can see how much you enjoy gardening. It's wonderful to connect with nature, isn't it? It's calming and refreshing.
Yes, it truly is. I used to find it very relaxing.
After our walk, we have a group activity planned. We're going to listen to some classical music. I remember you mentioning how much you enjoyed jazz. Would you like to help me select some music for the group?
Conclusion. As we conclude our training, let's reflect on what we've learned about managing ISB and dementia. We've explored the complexities of dementia, the intricacies of ISB, and various strategies to address these challenges. Remember, our approach should always be grounded in empathy, respect, and professionalism. The knowledge and skills you've gained today are crucial for providing compassionate and effective care to dementia patients. Thank you for your dedication to enhancing the quality of life for those living with dementia.